Hey, welcome to Living the Dream with MS. Today, I want to talk about something that is affects MS patients a lot, but it's actually just a general piece of living and life advice, I guess, which is patient as advocate. When people are involved in the medical world a lot, you get a lot of different medical advice. You get told to do a lot of things. The longer you're involved in that situation, you really learn that you have to be your own advocate. And I'll give several examples, but basically, what I mean by that is I didn't go to medical school. I know very little about the medical world in some senses. However, I am the world's most foremost authority on my body. And so I know what isn't right for me. In many cases, I know what doesn't work for me. I know what may not be appropriate for me. And so it's my job, and sometimes my wife or whoever's helping me's job, to stand up for that and disagree if something isn't right. A couple of examples. My veins, because of my MS, are quite poor. They're small. They roll. They're a challenge. So I have known for some time that a very small catheter for IVs is required. My ultimate life lesson, and where I said no more, was one of the first times I needed steroid treatments. And I had gone to the infusion clinic and was stuck 19 times in the period of 2 days before they were actually able to get it. Now, there are a lot of things I know now about how that went wrong and that I would never allow to happen again. But I have set forth my own personal rule that you are any nurse or doctor or whatever is allowed to attempt to stick me twice. After the second time, you need to go find somebody else. It's not personal, and there's no necessary science around it. That's my personal thing based on my experiences. I'm not going to let somebody continue to stick me over and over and over again. There are other things along those lines. Twice, actually several times, when having medical procedures where I needed to be put under. They were insisting that the smaller the gauge, the larger the needle is. And they were insisting that they were requiring either a 10 or a 12 in order for me to receive the anesthesia. The first time I allowed that, and they had to stick me until they once again got it in with a 20, which is one above a pediatric. So as I got older and things would come up, they would say, okay, well, we're going to start the IV so that we can do the anesthesia. And I'd say, okay, don't bother starting it with anything larger than an 18. Well, we can't, you won't be able to receive the anesthesia through that something that small. We have to have a 10. And this is where you have to have the self-confidence to say, no, I've had it pushed through an 18. You're not going to get a 10 in my vein. And at this point, I'm not going to allow you to attempt to put a 10 in my vein. Oh, I'm really good. That's nice. I've had really, really good nurses at Brigham and Women's, Mass General, UMass, Leominster, all attempt it. It's not about your skill. It's about my anatomy. So that's what we're going to do here. And if we're not going to do it, let's get the doctor in the room and we can have that conversation. Now, I have many, many friends that are nurses. Hopefully everybody understands this is not an attack on nurses in general or any particular nurse. You guys are trying to do your jobs, and I respect that to the nth degree. However, most nurses I've spoken to also respect what I'm saying, which is I know my body, so I'm not going to allow you to put me through something that I know isn't going to work. And that's something that you sometimes have to be adamant about. Another one, with MS, we tend to be the guinea pigs. Guinea pigs in a sense of, well, let's just keep testing and see if we can figure out why this is progressing and why this isn't progressing. So I had my first LP lumbar puncture in 1999. It was done by a very inexperienced not intern, medical resident. It was a terrible experience. And since then, I've had the diagnosis confirmed by visual evoked response, several other tests. So 5 or 6 years ago, when my neurologist recommended that I have another LP, I said, for what purpose? He said, well, I'm curious to see if there's any of the, and I don't remember the medical terminology, something bands in the spinal fluid. I said, no, absolutely not. No. Well, I really think that would be a good idea. And I said, I appreciate that. You're not the one putting the needle into your spinal column. It's not happening. There's no reason for it. And that's a stand that I had to take. It's a stand that I had to take because I had already been through the experience. There was no additional value, so that was not something I was going to allow to happen. On the flip side was the medical marijuana. He is not a proponent. I have a separate doctor that I deal with for that. He is not a proponent of medical marijuana. But I've always been very open because I feel like it's important for all my doctors to know what I'm doing so that if there's any potential cross issues or whatever, so I'm always open about it. So when I told him that I was using it, he kind of dismissed it. And then I went back in and he said, I really think that you should consider this. And he handed me an article. And I got home and this article was extremely poorly written. It was a quote-unquote study. It wasn't double-blind. It wasn't single-blind. There was no baseline testing, but the core of the story was that there was cognitive deficiencies being caused by medical marijuana. But there was no baseline testing to tell you that across the board, all the people had this same level of cognition or whatever the issue was. So basically, it was a hit piece on the medical MS, the medical marijuana community. So I went back into him and I said, with all due respect, I'm not a scientist and you are. I said, but would you ever accept a study that wasn't a controlled study, wasn't double-blind, or didn't have other control factors in it, didn't have baseline testing beforehand? Well, what do you mean? I said, that's what this article says. So why are you giving me this to contradict what I'm using that's been used for thousands of years, that's been established to work? Not only established to work clinically, but established to work by me, your patient, who's telling you that it's dealing with my pain and that I'm still as sharp as I ever was continuing to use it and not having a problem. Well, I just don't like the idea of it. Okay, fine. You don't have to like the idea of it, but don't give me a prop piece to tell me that it's okay. It's kind of like the prop pieces that they give you for a lot of other things. That's a big challenge for me. So I've kind of rambled on, but I really wanted to drive home the point for anybody in the medical world, but especially MS patients, because there's so much of it, that you need to be your own advocate. You need to do your own research. You need to be confident in who you are and what you feel, and to stand up for yourself when it comes to your treatment, because you are the sole and final decider as to what your treatment's going to be. And if you're not comfortable with the course of treatment, or you're not comfortable with the way that something works, you need to stand up for yourself and say, I'm not comfortable with this. This is what I would like to see happen. Or, I'm not comfortable with this. Can you give me another option? Because of that, I've become much more comfortable with who I am, with my doctors, and with my medical treatment. At this point, I'm going to wrap it up. I'm going to thank you for watching. I'm going to keep living the dream with MS.